Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard for the nursing department here at Nassau Community College. And I'm here along with my co-host, nursing a student at Nassau Community College, Michael Dorio. And today we're talking about how to improve cardiac function, boost cardiovascular performance, and build a healthier, more efficient body with our guest, one of the authors of Exercise for Cardiac Recovery, Will Smith. Mr. Smith works for a nationally recognized healthcare system in the New York area providing health and wellness services. His focus is in special populations and how healthcare providers and fitness professionals can work more closely together. His book is a complete guide providing everything from tips on how to integrate the program into our existing cardiac recovery protocol to tailoring made workout programs designed to strengthen your heart and circulatory system. So, Mr. Will Smith, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Yeah, thanks for having me today. It's a real pleasure to be here and an honor.
So let's start talking about basics about what your book is addressing, and that's how to prevent a heart attack. Or how does one know when you have had one or are having one?
Yeah, and it's obviously a very loaded question, and but it can be broken down in so many ways. And the thing that my co-authors and I, Chris Volgrass and Keith Burns, who have been career track fitness and health professionals, have always say up front in anything that we do together, because we are a hybrid. We do have that functional training background, but we also have that clinical experience just to stay within our scope of practice. And I think working hand in hand with our colleagues on the medical community, and then the healthcare side, I think we refine where we sit in that food chain, if you will. In terms of prevention of heart attack, working hand in hand with them, identifying those risk factors and getting those annual well visits to identify both modifiable and non-modifiable risk factors. I think once you can identify your own personal profile by working with a preventative health professional, let's say on the fitness side of it, and then also on the clinical side of it with your primary care provider, I think that's the first positive step into identifying whether you're likely or have a higher risk of having a cardiac event.
So you're talking about prevention and a personal profile. What goes into a personal profile? What are we looking at?
Yes. Yeah, absolutely. So a personal profile is obviously personal, right? It's unique to the individual. Going back to the modifiable and non-modifiable risk factors. So modifiable risk factors would be things that you can control within reason. Whether you smoke, smoking is by far one of the, if not the most modifiable and preventable risk factor for heart health and cardiac disease. Other modifiable risk factors include control of your body composition or BMI, your daily physical activity, what you put in your mouth as far as the diversity, the quality, and the quantity of the calories you take in every day, stress, and those types of things. The non-modifiable risk factors that fits into your unique profile would be things like age, your family history, your gender, things of that nature. And then I would also say, too, that in addition to that, you have other things that make you unique. As far as besides those two components, you have environmental factors. You have, where you work, how you work, who you work with, the things that are in your environment that you have some control over and some you may not. But those also feed into you having an overall kind of a healthier heart profile.
Well, we've all heard it before, but what are some of the warning signs someone is having or experiencing a heart attack?
Sure, and this my coworkers or my colleagues on this book, Keith and Chris, the reason we worked together for probably close to 14 years, and we've all worked in a variety of environments. And I think there are some kind of stalwarts in terms of the clients that we work with. Assuming somebody, we're working with a relatively stable population of people for the most part, meaning that they've been cleared, let's say, by their primary care provider and/or cardiologist, if they have risk factors, to participate in some kind of exercise program. So we always, first and foremost, if you have any family history or if you haven't exercised or been physically active in a long time, we always say go and get that well checked or get cleared first. But taking it a step further than that, on a very basic level, if you're working with a client, I think some of the things that a professional is going to look for is obviously different than what a person may feel and how they interpret that information from their own body. So as a professional, we're looking for a number of things. We're looking for, acute chest pain. We're looking for shortness of breath. We're looking for rapid pulse that's unusual, that's not a normal response to exercise. For the individual, they should be within a certain level of comfort. A low, or we like to call it an aerobic range. Generally, you're going to be able to have a conversation, or we call that the talk test with the person next to you or somebody you might be working out with. If you become hypoxic or your sentences are broken, that may mean that you're working slightly more anaerobic, which means you're kind of getting into that non-oxygen utilization zone. That's not a bad thing at all, absolutely. And I think my colleagues and my co-authors, Chris and Keith, will confirm that as well. Research has indicated recently that, it's fartlek training and high-intensity training, that's a good thing. But when it goes beyond what somebody is comfortable with, especially if they're beginning an exercise, I think some of those identification signs, if you will, or risk signs that we just mentioned, somebody should be on the lookout for.
So when it comes down to these warning signs, might they differ between male and female in terms of what you experience before having a heart attack, those warning signs?
Yeah, that's a great question, and it's always so interesting because the mortality and outcomes of somebody experiencing some kind of cardiac event on the gender side of it. And I would always defer to my clinical colleagues on this front because they're the ones who are working on the acute care side of the patient. But in terms of what we see on the fitness side, the clients that I've personally worked with on a very pragmatic level, when we see ladies come in, and I always joke with my wife about this, who's in her, about the fact that women have more EI or EQ, like emotional intelligence or kind of emotional quotient, when
I think that's true.
It's funny. It's funny you say that because I think I work in the healthcare industry, right? And I think you guys do too. And 80% of those who work in our industry are female, and so I don't think there's a mistake for that. I think there's an emotional intelligence that goes along a lot of times, whether it's we're working with a patient or your own, to say, hey, I'm not feeling so well, or I have chest pain, or I have tightness in my chest, or this stress doesn't feel quite right, or I have a rapid pulse, or what have you. Ladies might be a little bit more, just from my experience, might be a little bit more inclined to get that checked out. On the male side, my male patients that I've worked with over the years have been so receptive to getting information. But unfortunately, I think sometimes when it comes to men, we put up that rough, wall, if you will, and say, hey, that rapid pulse is not a big thing. My quality of sleep has diminished, or I'm not sleeping as well. I'm okay with that right now. Or the stress at work is normal. It's normal for me to go home at night and not sleep well, or so and so forth. I haven't been to my doctor. So I think it's really important when you're dealing with and working with a male or a female client to say, hey, you should be aware of these things. If you've had a heart attack, if you're a woman, you should be aware of 1, 2, 3. If you're a male and have a heart history, and let's say you have high cholesterol and your LDL is really, really high and your HDL is low, these are things you can do on the preventative front to kind of modify that and lower your LDL while boosting your HDL. I also think this is a great segue into just commenting on physical activity. I think men tend to gravitate towards exercises that that lend up to their maybe upper body strength or things of that nature. Where on the ladies' side, they may gravitate towards more cardiovascular activity or things. And I'm just subjectively speaking here based upon some history. But I think it's really, really important with any population of people to know who you're working with, know how the gender breaks down, and know the risk factors that affect each of those individual gender segments.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with my student co-host, Michael Dorio. And today we're talking about how to improve cardiac function, boost cardiovascular performance, and build a healthier, more efficient body with our guest, one of the authors of Exercise for Cardiac Recovery, Will Smith. So, Will, have you ever seen in your practice someone who's the picture of health and eating a very clean diet, a healthy diet, doing everything right, exercising, and have a heart attack?
Yeah, cardiac event, absolutely. Yes. And it's so strange because when I first started my post-rehab in-home exercise therapy practice in 2005, my very first client in New Jersey, a personal training client, was actually an interventional cardiologist that ended up referring 90% of my patients to me that I worked in home with, and I had trainers that worked for me. And one of the things, his first name's Fred. One of the things Fred always told me, he really taught me, is that what's on the surface isn't always what's going on inside. And we used to see that when we used to do a lot of gross anatomy dissection as well in the lab, is that you could have a seemingly healthy individual, to your point, but then you put them, let's say, through a DEXA scan or look at their deep belly fat or visceral fat or what have you. I give a point in case. Asian Americans, they have very slim bodies, but there's been a preponderance, some of the research I've read about how they do have a tendency to have that deeper visceral or DEXA fat, where on the surface they have a slim body frame and what have you, where there's certain populations of people that may look completely normal, right? That in case, but then on the flip side, when you start actually putting them through the diagnostics, it doesn't always hold true. And let me give you another example. Executive health physicals. Executive health physicals, and Chris and Keith used to work at a nationally recognized center in Princeton for this, where they used to do angiograms and DEXAs and everything like that. These concierge executive physicals have taken off because when an executive goes down for God help us, for whatever reason, it's a huge disruption in the business practice. So what they found when they go through the executive physicals, that somebody who is seemingly healthy could have, a widowmaker or 90% blockage in some cardiac artery, or coronary artery. But then they go through these screenings, and then they're on the table the next day getting a stent put in or something like that. Yeah. So I think it just lends to the question that, or to the point that you never know what's going on inside of you. That's why you should make sure that those modifiable risk factors that you can control are good, and even more importantly, in some respects, know your family history.
Will, can you ever fully recover from a heart attack?
This is where, that is a great question. This is where exercise is so important. So when you have a heart attack, depending on what level of the cardiac event, right, you're going to be able to recover. And that's why they have, that's where this seismic change in healthcare is really, really important right now, where we're decentralizing more care into the community and working with physical therapists or cardiac step-down programs or personal trainers, because the recovery aspect is so important. The hospitals do a great job of step-down care. So when they step them down into that, subacute exercise physiology monitored facility that is going to, number one, build their strength back up, build their cardiac tissue back up, maybe re-thicken that left ventricle a little bit to improve that ejection fraction and cardiac function, delivering more oxygen to the body. Absolutely, that will help with recovery. But I think the most important thing is, in the recovery train, to continue what they learned in the hospital, is when they get out into the community, what do they do? And you may not recover 100%, but you can regain a tremendous amount of overall work capacity, even though some of that heart tissue might have died. What you can do is you can supplement a lot of that cardiac function by strengthening the entire holistic aspect of the body. One place that comes to mind is the YMCA, where I kind of cut my teeth when I was in high school. They had amazing kind of step-down programs where a person that had left the hospital, assuming that they're stable and had been discharged and cleared by their doctor, they could go and have their blood pressure checked and their pulse checked and what have you every time they went in and out of a YMCA, and they'd be prescribed an exercise program that would be overseen by a floor trainer or an exercise specialist. So all of that lends into recovery from, a cardiac event, but even more so, you have to take the long view at this, and it's not just exercise, it's the lifestyle piece of it as well.
Let's take a quick break. My name is Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with my student co-host, Michael Dorio. And today we're talking about how to improve cardiac function, boost cardiovascular performance, and build a healthier, more efficient body with our guest, one of the authors of Exercise for Cardiac Recovery, Will Smith. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Some knowledge belongs to us and us alone. The way our girlfriends walk, talk, touch their hair. Details that only a sister can know about her girls. But what about our other girls? The ones we carry with us every day. Our bond with our sister girls gives life. But knowing your breasts can save it. Go to knowyourgirls.org for the facts you need on breast health. Brought to you by Susan G. Coleman and the Ad Council.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thanks for being with us today. This is Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with my student co-host, Michael Dorio. And today we're talking about how to improve cardiac function, boost cardiovascular performance, and build healthier, more efficient bodies with our guest, one of the authors of Exercises for Cardiac Recovery, Will Smith. So, Will, we left talking about recovery from a cardiac event. So this is really called cardiac rehab. Can you tell us about these services? You kind of pinged on it before the break.
Yeah. So the cardiac rehab, right? Cardiac rehab had gotten that perception, and for good reason. The last 20 or 30 years, where somebody would be on a treadmill walking for a given amount of time within a target heart rate reserve, or monitor potentially on with an EKG or some other diagnostic equipment, especially if they were in the immediate subacute level on the cardiac rehab side. I think what has happened now in the last few years, maybe the last decade rather, is strength training, and the more holistic components of the cardiac element have come into play, and you're going to find that exercise in terms of strength training, flexibility training, functional training, where a patient is doing things that is going to incorporate their whole body, which by strengthening the muscles, you're ultimately going to utilize oxygen better and take stress off the heart, improving your overall work capacity. That has all blended into the new idea of what cardiac rehab is and how it should be viewed. The other kind of footnote to that is a lot of the hospitals now, due to the changes in the way that healthcare is being reimbursed now with the centers of excellence, a lot of the conditions that are being discharged, including, maybe it's congestive heart failure or other things, the hospitals are getting hit if patients get readmitted for the same condition. So that's why it's really, really important when you look at something like cardiac rehab that the hospital connects with the community providers to make sure it's not just an acute care provider that's provided in terms of the cardiac rehab element, but also how that patient transitions out into the community, whether it's a YMCA or a fitness center or working with a personal trainer or exercise specialist. Not only is the cardiac component handled, but they transition into more of the strength training and the functional training as well. So there's definitely defined elements to that. And when employees, are stable as far as their heart rate and their pulse rate and things of that nature, I think it's a really good indication of that the cardiac rehab program is heading in the right direction.
So when you're talking about cardiac rehab, this is after you've been hospitalized, you're discharged to where? Where does cardiac rehab happen?
Yeah, so cardiac rehab, so in the hospital, we have the acute care setting, right? And for people who are listening to this, kind of visualize, put things into a box just for conversation's sake, to compartmentalize it. So we have the hospital, we have your brick and mortar facility that people go to that may or may not want to go to, if they have an event. And event meaning they might have had a heart attack, or they might have had potentially a stroke if on the neurocardio side, but they've had something happen. They get treated acutely at the hospital. It could be a cardiologist, a surgeon, what have you. After that procedure is done and that patient is stable, they then would be transitioned ideally to some kind of, it might be a hospital-affiliated department, more than likely, which could be on the hospital grounds or in an outpatient center. And then that patient, assuming their risk factors are stable, they have their risk factors are in terms of their heart rate, their EKG, their diagnostics, are being transitioned over to one of these facilities, a step-down facility, we like to call it. And in that step-down facility is kind of a transition back to the community. So they would work with usually a clinical exercise physiologist that might be certified through the American College of Sports Medicine, which a lot of our principles in exercise cardiac recovery are based off of. That person would be monitored for whatever the prescribed protocol is for that condition. Could be, 4 weeks, it could be up to 12 weeks or 16 weeks. And then they'll step down even further, where they're usually a step-down program, or what we like to call as a post-rehab program, where the patient, at that point, it would be, maybe on an outpatient level, would be taught how to implement healthy daily practices that create more independence. So that could be, this is the exercise program you're going to do on your own. This is the exercise physiologist that's going to teach you how to do it. Now, 3 days a week, we want you to do this on your own. You can still maybe do it in the outpatient hospital facility, but we also want to transition you to create that level of independence where maybe you could do it at a YMCA. I'm trying to think of some other large fitness clubs that might have that blood pressure and pulse rate component where you can get that measured inside and out. And then after that, there would be regular touches with your cardiologist, your primary care doctor, and so on and so forth to make sure that your blood pressure, your heart rate, your blood work, your cholesterol, all your creatine levels, all of those things that are relevant to monitoring your overall cardiac health, your inflammatory markers are stable, if not improving.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with my student co-host, Michael Dorio. And today, we're talking about how to improve cardiac function, boost cardiovascular performance, and build healthier, more efficient bodies with our guest, one of the authors of Exercises for Cardiac Recovery, Will Smith.
Will, what are some of the cardiovascular activities you'd recommend to someone that wants to stay healthy and hasn't had a heart attack or any other cardiac issues?
Yeah, absolutely. Great question. So we have a number of things that you can do. I think we're gonna break this down into 3 steps. The first step is going to be, if you haven't established a baseline, how do you know if you're improving, right? So we're gonna put some metrics to this, and that you don't have to go to the hospital or go to a gym to do this. There's many field tests that somebody could do to measure their current level of baseline. My colleague, Keith Burns, co-author, gave another great recent presentation via podcast, and he talked about the Rockport 1 mile walking test. So you can go to your local track. You can even measure something in your neighborhood, but I like to use a track just because it's flat. It's consistent. There's a baseline you can always go back to versus weather or what have you on the roads. Go find your local track. Walk around. It's not a running test. Walk around that track as quickly as you can, and then measure how long that takes. And then there's an equation you can put that in. But very simply, you don't even need to use the equation. What you can do on your own is get a journal, see how long it takes you to walk a mile, which for most tracks is about 4 laps. Write down what your pulse rate is before you start, about halfway through, and then when you get done, about 2 to 3 minutes after you get done. Use that as your baseline and reassess yourself about every 4 weeks or so. That's what we call as a field test. And if you don't want to go outside, you could simply do a step test at home for 2 or 3 minutes using the same parameters: heart rate before, heart rate midpoint, and then heart rate after.
And what is our goal? What is the goal? What do we want to see after this?
Yeah, absolutely. So when you're starting with one of these, baseline programs, where we like to look at somebody, rate of perceived exertion, right? So when you start to do this screen, the first week you do this, all of this screening may feel like 90%, like, oh my gosh, this is the hardest thing I've ever done. And then you back it down a little bit and say, you know what? Let's come back and remeasure in 4 weeks. We're going to follow the American College of Sports Medicine guidelines, which is about 150 minutes of exercise per week. So maybe you go walk if you're at this level starting out. Maybe you walk about 5 times a week for 30 minutes if that's too much. You could back it down to 20 minutes, so maybe you do 100 minutes a week. And then you try to maintain that consistency for about 4 weeks. And then at the 4-week marker, you would reassess yourself potentially with whatever the test was that you did before. So it could be the Rockport test, 1 mile walk, or it could be the stair stepper test. But the idea is that whatever you're doing prior is getting a little bit easier, and you're increasing or finishing that 1 mile walk, let's say, or step test in less time, and your heart rate is staying a little bit lower, and even more importantly, your recovery heart rate after you get done returns at a faster rate.
William, if one of our friends were listening and wanted to get in touch with you for more information, what is the best way to contact you?
Yeah, absolutely. So I can be contacted a number of ways. You can obviously find us on Amazon. That's where you can find our books and what have you. If you wanted to contact me directly, I'll give you my AOL, which is, I'll usually check that a couple times a week. It's WStrength at AOL, is in AmericanOnline.com. So WStrength at AOL.com.
So now, when we're talking about prevention, tell us about before or after having a cardiac event. Tell us about our diet. What is the connection between exercise and diet?
Yeah. Oh, so I think one of the underlying footnotes for exercise and diet is inflammation. We live in a very most people take in food or not that can lead to inflammation within the body. Whether it's there's always that cholesterol debate on whether the cholesterol is there first or what have you. A lot of times they're finding with new research that when there's systemic inflammation in the body, right, the body naturally kind of builds up plaque in the body to, let's say, fill in fissures and vessels and things like that. And then the cholesterol kind of follows on top of the plaque. And a lot of that, just as one example, is from inflammation. And inflammation comes from a number of different ways that are linked to both diet and exercise. We know that exercise acts as a protective mechanism in many cases because it boosts the HDL in the body, which is a good cholesterol. And for the listeners, cholesterol, you have your total cholesterol or TC, and then you also have a component to that are your HDL, your LDL, and there's a very small number called VLDL, which is your very low density lipoprotein. So there's kind of different components to that. But exercise can actually raise up the good cholesterol. It's been shown that's why it's good to kind of push yourself a little bit, because more intense exercise has been shown to hopefully raise up that HDL a little bit more than just low intensity for a period of time. Diet-wise, we like to use the color paradigm. So the more colors, the better. You want to eat consistently throughout the day. Large meals at one time can be stressful on your digestive tract, which again can cause more inflammation. So eating consistently throughout the day is a good thing. The more colors, the better. Fiber, low salt or low sodium intake, and plenty of water throughout the day. And as far as fluid intake, which is an area I need to work on and to better, is that they like to, what the dietitians I've always worked with said, hey, your urine doesn't have to be absolutely clear as a marker, but it should be at least very pale or close to clear. And that's usually a good sign if you're properly hydrated. And the other recommendation that's often made, and again, if you have a cardiac history, just be aware of salt intake and things of that nature. But the general recommendation is to take about half your body weight every day in ounces. So I weigh about 200 pounds. So, I'm going to take about 100, maybe 90 to 100 ounces of water in per day. So that kind of touches on the exercise, the diet, and then the hydration piece, which really a lot of that is linked to inflammation.
Well, that has been very informative. Thank you, Will Smith, one of the authors of Exercise for Recovery, Cardiac Recovery. Great information to be aware of for sure. So this is Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with my student co-host, Michael Dorio. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.